Good day, everyone. We are the student nurses from the University of St. LaSalle, and we are from Group 3B. And today we're going to present our research study entitled Incidence of Anxiety Among Nursing Students. And the presenters are yours truly, Zenir Figuera, Ella Valeriano, Nina Valeriano, and Cyril Villanueva. This study aims to determine the extent of academic anxiety and its effect on the academic performance of nursing students. This may help student nurses to avoid this situation for them to perform well academically and be able to provide high quality nursing care to the patient. Anxiety is one of the most common obstacles teens and young adults face, especially nursing students who usually have a higher level of anxiety due to academic requirements for the entrance of the program, course structure, long hours of lectures, return demonstration, and clinical exposure, plus they work with sick and problematic person. A nurse educators need to develop an awareness of possible student nurse stress and facilitate students' ability to cope effectively with new challenging stressors. It may be beneficial to prepare students before a very stressful time in the nursing program. This study aims to determine the incidence of anxiety among nursing students in the University of St. LaSalle. Specifically, it seeks to answer the following questions. What is the demographic profile of the participants in terms of the following: age, sex, and year level? What are the common causes of academic anxiety among nursing students? Is there a significant difference in the cause of academic anxiety among nursing students when taken as a whole and when they are grouped according to age, sex, and year level? This study is beneficial to the University of St. Casal administrators to implement the programs that were created by the Guidance Council, College of Nursing Officer to approve the programs were created by the clinical instructors to understand the struggles that their students are facing, College Guidance Council, School Administrator Center to guide and help students to handle the problem and give them some advice, student nurses. The study will help the student to determine the effect of anxiety to their academic performance and will help them how to cope with it. To the parents to be aware that their children is suffering from anxiety or stress. Future researchers, the study will provide future researchers with information on studies related to the research and it can be used as a reference and guide.
For the theoretical and conceptual framework, the study utilized the Newman system model. It starts with the nursing students with the variables such as age, sex, and year level, followed by the causes of anxiety of the nursing students, which are heavy workload, low academic performance, overlapping and timely submission of assignments and tasks, combining clinical with academic workload, and lastly, school and hospital clinical practices, which led to the incidence of anxiety among nursing students. For the hypothesis statement, there is no significant difference in the cause of anxiety among nursing students when taken as a whole and when they are grouped according to age, sex, and year level. For the research design, the study is a quantitative method and descriptive design is used to answer the following questions, such as who, what, when, where, and how it is associated with a particular research problem. This research cannot conclusively ascertain to answer why. For the participants of the study are the nursing students, specifically the 255 nursing students of the University of St. LaSalle. Research utilized a stratified sampling technique as it enabled the researchers to process the data by selecting a random sample from each year level in the College of Nursing. Researcher gave a survey questionnaire to each year level, starting from the first year, second year, and the third year level. For the research instrument, the study used a research-made surveys, which is a survey questionnaire that is based on the objective of the study. This study utilized a Likert type of survey research questionnaire, and it consists of 14-item questions. 3 validators critique the questionnaire, who are also the nursing clinical instructors in the university. Crunchback alpha test is used to test the credibility of the instrument of the study. For the research instrument, the study used a research-made surveys, which survey questionnaire that is based on the objective of the study. The study utilized a Likert type of survey research questionnaire, and it consists of 14-item questions. 3 validators critique the questionnaires, who are also the nursing clinical instructor in the university. Crunchback alpha test is used to test the credibility of the instrument of the study. For the data gathering procedure, the research made a questionnaire that is based on the objective of the study and validated the research or the questionnaire to the validators and through the validity test. Researchers wrote a letter of permission from the Dean of the College of Nursing to ask for authority to conduct the data gathering. Then, researcher asked some nursing students in the first year, second year, and third year level for their approval to answer the survey.
For the statistical treatment, this study used the SPSS software tool and the survey data will be encoded to the Excel spreadsheet. Researchers think that the SPSS will help the data to be more accurate and reliable. On statistical treatment, the data are processed using descriptive statistics such as percentage and central tendencies, mean, median, mode. For the ethical considerations, researchers asked permission to the students in College of Nursing by explaining why the researchers need to conduct this survey. Researchers asked each encountered nursing student for their approval to answer the said survey that contains 14 questions. Researchers kept the names of the participants and the participant's name is optional. Researchers ensured that the data gathered are kept confidential and are only accessible to the researchers who conducted the study. For the result and discussion, most of the participants belong to 18 to 20 years old, while 0.8% belong to 16 to 18 years old, and 30.6% belong to 20 years old and above. In gender, 77.3 were females, while 22.7 were males. In terms of year level, level 1 has the highest percentage, while level 3 has the lowest percentage. There is no significant difference in the anxiety among nursing students when grouped according to age and year level. Therefore, the null hypothesis is not rejected. The table shows that the factors that mostly affected the level of anxiety are during written demonstration, post-test, exam, lectures, assignments, tests, oral recitation, and duty week or clinical exposure. But the highest percentage of participants answered always who are frightened to make procedural mistake in front of their clinical instructor with a result of 58.1%. Conclusion, researchers conclude that the primary cause of anxiety among nursing students are due to written demonstration, post-test exams, long hours of lectures, assignment tasks, oral recitation, and duty week or clinical exposure. Afraid of making procedural mistake in front of clinical instructor or patient during duty week. Doing charting, which is very important data to the patient, and doing paperwork requirements tasks that needs to be submitted on the same week.
Recommendation. Students must be taught effective stress coping strategies in their education and training. It is also important to know and be aware of an individual student's personality and coping strategies and abilities. In clinical training, it's necessary for nurse educators to continue their efforts to help nursing students manage their stress and anxiety. The more they become competent and successful nurses. Mental health awareness programs and activities can help improve the psychological well-being of nursing students. This will help nursing students gain awareness and provide them with a more comprehensive participatory understanding. Parents and educators should understand how the students cope with stress and can play a main role in making a supportive, healthy environment. Utilization. Relate to University of St. LaSalle administration to help in management of anxiety among nursing students. This can help manage resources to avoid anxiety, to enhance their academic performance and clinical skills that will help student nurses become productive and contributing members of the nursing profession. A copy was endorsed to the College of Nursing faculty upon completion of the study as basis to support student nurses in dealing with anxiety. The data will also be available to serve as a basis to students who are interested in this research topic as their references. References. Acknowledgments. We would like to express and give special thanks of gratitude to all the people involved in this research paper. This wouldn't have been possible without the help and support of everyone. First, we would like to praise and give thanks to all the nursing facilitators that were there as a teacher, mentor, and by giving us the knowledge and the support that we needed to accomplish this vital nursing research paper. So thank you, Dr. Sheila M. Trujera, Dean Ivy Ademny, Dr. Leslie Young, and Sir O.J. Jimenez. Our deepest gratitude goes to you guys. To our fellow nursing students, we are grateful that all three levels of nursing students were kind enough to participate in this study. So thank you everyone for participating in this questionnaire survey, as that data was very vital in our research paper. We would like also to thank the University of St. LaSalle in giving us the opportunity in doing a much-needed nursing research paper pertaining to a problem that most students face in a modern era of learning. Thank you for giving us an experience we will never forget and an opportunity to widen our horizon. Last but not the least, we would like to thank our family by giving us moral and financial support. Then a special thanks to God for the blessings and keeping us focused on our goal.